We humans need oxygen to live. We read this in school, but we learned it during this pandemic. In India, we saw people battling to breathe. Oxygen demand shot up with a sudden surge in cases. Last year, this happened in the United States and Europe too, the sudden demand. And now it is happening in many more countries. They're recording high death rates due to oxygen shortage. As we speak, at least 19 countries, 19 countries are suffering oxygen shortage. This list includes Argentina, Colombia, Iran, Nepal, the Philippines, Malaysia, Thailand, Pakistan, Costa Rica, and South Africa. The list has been put together by the Bureau of Investigative Journalism. It says that the situation in these countries has been exacerbated because of low vaccination rates. In Nepal, the demand for oxygen has risen 100 times between the months of March and May. Climbers were being asked to bring back their empty oxygen tanks from Mount Everest so that they could be refilled and used in hospitals. In Sri Lanka, the demand for oxygen has risen 7 times. In Pakistan, oxygen vendors have doubled their prices for the last month. The crisis goes beyond South Asia, in fact. In Laos, for example, there is a 200-fold increase in the demand for oxygen. According to the Bureau of Investigative Journalism, there are at least 30 countries that currently need twice as much oxygen as they did in March, 30. This list includes Fiji, Vietnam, Afghanistan, Cambodia, Mongolia, Angola, and Kyrgyzstan. The question is, does the world have enough oxygen to cater to this rising demand? Medical oxygen makes up for just 1% of global liquid oxygen production. The remaining 99% is used in industries, the likes of mining, petrochemicals, aeronautics, and water treatment. Over the last few months, countries have asked oxygen companies to divert their supplies to hospitals. Even if more countries follow suit, the ones most in need will still not have enough oxygen to cater to the needs of the hospitals. Iraq's gas company, for example, can produce only a third of what the country's COVID patients need. Colombia, less than 2/3. Peru, only 80%. These are just a few of the many examples. But do you know what they tell us? That more countries are staring at a repeat of what happened in India and elsewhere. A sudden surge in cases made worse by crippling shortages. In fact, something very similar is already playing out in Japan. We have a report for you. Take a look.
This is Osaka. It is Japan's second largest city, home to 9 million people. 7% of Japan's population, but a third of the country's COVID-19 deaths. The Wuhan virus has spread rapidly in this city. There is a huge wave of new infections, nearly 4,000 every day. The young and the elderly are falling sick alike, and Osaka is crumbling under the rising cases. The city's healthcare system has collapsed.
Simply put, this is the collapse of the medical system. We cannot take in patients.
Osaka is running out of beds and ventilators. Doctors are burnt out.
There are some ICU staff saying that they have reached a breaking point.
Some public health nurses are doing over 100 hours, 150, 200 hours of overtime, and that has been going on for a year now.
While the pressure on hospitals is high, the rate of hospitalization is extremely low in Osaka. Just 14% of the patients have been hospitalized. The rest are all fending for themselves at home. In the capital city of Tokyo, the hospitalization rate is 37%. Rates lower than 25% are grounds for imposing an emergency in Japan. Commercial activities have already been restricted in Osaka. Emergency has also been declared in 8 other regions. The news has spread to countries on the other side of the globe. The United States has warned against traveling to Japan. Like we said, it's a déjà vu. History is repeating itself, and another country is crumbling under the onslaught of the pandemic. The new wave of infections in Japan comes months before the Tokyo Olympics. Those at the front line are warning against holding the games.
They say the Olympics will be the symbol of overcoming the coronavirus, but we haven't overcome the virus yet. From a medical point of view, the most important thing is to have the number of infected people under control. The medical staff wants people to avoid gatherings.
At least 90,000 people are expected to arrive in Japan for the Olympics. Is this a disaster in the making? Bureau Report, WION, World is One.
WION is now available in your country. Download the app now and get all the news on the move.